Hello, my name is Rachel Edwards. I am a medical assisting student here at BYU, Idaho, and this is the medical billing and coding class, MA 111, and today we're going over a case study for Chapter 7, talking about CPT coding. And in this case study, we're dealing with a patient. Her name is Michelle. She recently came into the facility. She had a chief complaint about a mole and had a biopsy performed. And she called because she's worried about the bill that she got. She doesn't understand why she got a $650 bill when she thought she'd go in and just be paying one set price for an office visit. So my job as a medical assistant is to explain to her why she got that bill and why it's more than what she expected. So in order to do so, I'm just going to briefly kind of explain about coding and the difference between diagnostic coding, CPT coding, EM coding. So to start off, when a patient goes into a facility, when they come into the facility, from the moment they walk in the door, they're going to start having everything that's done documented, coded, and billed. And a lot of times people just think you go in, you pay for just coming in. But really, every little detail and everything that happens will need to be evaluated and documented and paid for. So a diagnostic code is like an ICD-10 code, and that one is just explaining the reasons why the patient's coming in. It's explaining their chief complaint, the doctor's diagnosis. But a doctor can't be paid for just you having diabetes. A doctor is paid for performing tests to discover you have diabetes, for evaluating you, for examining you. That's what they're paid for. And when Michelle came in, the first thing that they had to do is determine whether she was a new patient or if she was an established patient in the facility. Now, the reason it's important to understand if a patient is established or new is that a new patient, you're going to need to take a lot more time to find out what's going on with them. For example, if they're an established patient, then they already have charts and information. They've already filled out paperwork. They just come in, the doctor reviews the charts, goes in, and can already just get started right away with their complaint. Where if it's a new patient, you're going in, you have to find out all their medical history. It just takes a lot more time. So time is money, and you're charged for that. So the first thing, before you can even put a code or a procedural code, CPT code, to the procedures that are performed, such as her biopsy, there's something called EM coding, which is Evaluation and Management Services. And so that has three factors. There's the patient history, when you find out what their complaint is, why they're coming in for, their past medical history, family history, social history, and then also the present illness that they're dealing with. And then there's also the physical exam. That's another factor. So depending on how severe their case is, whether it's just like a common cold or if it's cancer, is going to change how much of an evaluation you're going to perform on them, because there's different parts of the actual examination. There's taking their vitals. It begins with that, and then you're going to examine the body area that they're complaining about, and then you're going to examine the body system, everything that area could be affecting. And like I said, there's a scale, so depending on where they fall on the scale is what code you'll use for them, because it depends on the severity. And the more severe, the more time. So then the other part of it is medical decision making. And the reason that's important is because the doctor, after diagnosing or having a prognosis, they're going to determine if you're going to need more tests, if you're going to have different procedures performed in order to take care of the patient, to treat the patient for whatever they came in for, whatever their diagnosis is. So those are EM codes. And then after you have those EM codes and you've determined the severity of the situation, then you can begin coding for the procedures, which is the CPT coding. And there's also some factors that play into that as well. There's counseling, the coordination of care, and then the presenting problem or their chief complaint. So depending on those things and how much time the provider is taking to do those things will also determine which code is which. But time mostly comes into play with the procedures and like what procedures are being done. So for her, when she came in, she had an evaluation. They had to look at her mole. So there's a code for that, and there's a charge for that. And then she probably got her vitals taken, most likely. She did that as well, so there's also code for that happening. And then after they made a decision to do the biopsy, there's another code for that, EM code. Then she had the biopsy, which is a different CPT code. So there will be that surgical procedural code. And so what she doesn't understand is that there were all these little details for her procedure, for her visit at the doctor's office. It was more than just coming to the doctor that day. There were all these little things that happened that were coded and that she was charged for that will be sent to her health insurance. So what I would explain to her is I'd say, Michelle, when you came in, you were seen by the doctor. He examined you, he talked to you, he counseled you in certain things. He prepared you for a procedure, he told you about what you needed done in order to treat you for what your chief complaint or what you were concerned about, that mole. And so before he can actually find out what's wrong with you, he needs to do this biopsy. And so that biopsy is going to be an additional charge because he performed or treated you for something that costs a little bit more. So that's why your bill is $650 and not just an office visit, because you had different things done while you were here. So hopefully that helps you, Michelle, to understand, and everyone else to kind of somewhat understand my explanation about coding. It's very interesting, and I've learned a lot about how the little details in the medical office are all taken care of. So next time you go to the doctor and they're taking your vitals and then you're talking about things and counseling with them, just know that all those little things are being coded and that are being documented. So next time you go in, the doctor will know what he did with you, what he talked to you about, everything. It's all written down, and then also that will be sent to your health insurance so that you're charged according to the care that you received. And that's how medical offices and physicians and healthcare providers make money, because they're getting paid for what they do. And it's also being documented so they know what things have been done. So sorry this video is a little bit longer than expected, but you could cut it off whenever. So that's my case study, and goodbye.